Dr. Cook left a legacy of being a caring physician, wonderful husband, a community leader, and making sure that some of our patients that had the most need got the best care. In the mid-1990s, Dr. Cook became the medical director of our wound care center. During this time, Dr. Cook served the community and caring for those people that no one else wanted to care for. In the 1980s, when AIDS was new, he was willing to take these complex new patients that a lot of people were very afraid to take care of.
And I guess the best way you could describe the experience of working with Dr. Cook is that you thrived if you survived. And he would appreciate that.
There was no one that was too infected. There was no one that was too addicted, no one too poor, or no one too badly behaved for him to do something for them. In fact, that might have moved him up to the front of the line for him. The real test of your character is what you will do for people who are unable to reciprocate. I also had the pleasure of going on a trip with him to Kenya one time. And during the trip, he told me that we didn't pray enough, and he was right. But I do know that in the Lutheran church in Kenya, where we were at, has set up a board and is administering a Biff Cook Emergency Student Loan Fund. And I know that 6 kids that wouldn't have otherwise been able to go to college are in college this year in a country where there is no such thing as financial aid.
Dr. Cook had a long career in Longview, serving the public, taking call, and was well respected by his patients. And Dr. Cook's dedication to his career is probably most reflected in the fact that the wound care center, where he devoted a large part of his career, was named in his honor, and well deservedly so. What I'll remember most about Dr. Cook is that he inspired me to step outside of my own comfort zone because of his dedication to mission services. A large part of his time was spent serving people in Central America, and through his example, I learned the importance of mission work.
My name is Biff Cook. I'm a general surgeon in Longview. I got associated with the mission trips to Niltepac in 1986. A friend of mine from Dallas had been going with his father-in-law, and he told me about this trip that he took to Mexico and was very enthusiastic about it. And I told him sort of off the cuff that if he ever had need for another surgeon to call me. That we go down and help him with cases, and we try to focus on people who don't have money. Usually we'll have breakfast together and then have a brief devotional, after which we start the cases. This time we did 8 cases one day, and then another 4 or 5 the next day. I've got about 1 million of these. What then happens is we have a recovery room that's an open air, basically a ward. There are 4 beds in each ward, and the patients will go there until they recover well enough to go home. Well, why you do this kind of thing is not easy to explain. To be really honest, I do it because I get a good feeling from being there to help. I also have met some people along the way who have become lifelong friends. We frequently refer to Niltepac as our second home. I think in some ways what we do is our way of returning for the gifts that we've been given. What it became was an experience that really kind of turned my life around. So even though we're not evangelists, the people in Mexico and other people who go with us understand that there's a sense that this is something special.
Next. Next time.
We used to say we get to go do what we do for a living, to do it for free and for fun. I think that probably explains it about as good as I could any other way. Somehow God opens a way when it's time for us to go.
He was a wonderful man. He was a man of great faith. And we miss him very much, but I know he's with the saints.